All right, folks, welcome back. This is Chapter 20, Vehicle Extrication, Search and Rescue of the Emergency Medical Responder Program. All right, so as an introduction, sometimes we get into situations that we call special rescue. They can include water rescue, diving problems, ice rescues, confined space rescue, farm emergencies, and bus collisions. Folks, I want to tell you right up front, this is special rescues, so you got to be trained to do this. These are specialty classes. They're awesome, really awesome stuff. And you get to practice with some of the best people and learn the rescue techniques that's involved in this. So let's talk about this stuff. All right, so extrication. Rescuers should always wear protective equipment to include coats, pants, boots, helmet with face shields, and gloves that are appropriate for the type of rescue or extrication that you're going to perform. Basic guidelines, you need to know the limitations of your training, equipment, and skills. Hazards, there's lots of them out there, so identify them and make sure that they're negated. Also control those hazards for which you are trained and equipped. Gain access to the patients and provide patient care and stabilization, and move patients only if necessary. And if you got to move them, make sure you have EMS personnel of a higher authority, a medical authority, that's taking part of that so that the patient does not get further injured. An emergency medical responder, you may have you do have two primary extrication goals: safe access and ensure patient stabilization. Those are two things, okay? Two basic roles. Step one, overview of the scene. As soon as the dispatcher tells you the incident, begin to anticipate and plan for what you're likely to find on arrival. So on the way to the call, you need to be thinking, okay, it's a head-on collision. I'm probably going to need some heavy rescue equipment, okay? Anything that you can get from dispatch, such as what type of vehicles are involved, whether there's injuries, trapped people, burning vehicles, hazardous materials, those kind of things. That kind of information is going to come from dispatch. As you approach the scene and before you exit the vehicle, get an overview of the entire incident. Determine rapidly the extent, okay? How bad is it? How many vehicles involved? Possible number of patients? Any hazards? Anything on fire? Anything sparking electricity? And call for assistance as needed. And if it's not safe, don't get out and go play in it, because it's going to hurt you. So just don't do it. Make sure you have the right teams there for the job, okay? And call early, as soon as possible. All right, so in this particular photograph, we got a lot of stuff going on. We have a truck that right away, when I look at pulling up on this scene, has one of these on it. That is a placard, folks. That is a flammable placard. I cannot tell what kind it is, but this looks like a fuel truck. I also noticed some other things here. This can hold a lot of fuel. Could be diesel fuel, could be regular fuel, regular unleaded fuel. Could be lots of different potentialities. Same thing here. There's also another issue: stability of that vehicle. It's on its side, practically rolled over. I mean, this thing could roll over at any moment and crush anybody. Yes, I have a car that is, wedged up underneath it. But more potentially, I have a lot of hazards that can come out of this scene. I look at these people. There's some dirt, looks like they threw out to try to negate some of the fuels leaking out of it. Hydraulic fluid, transmission fluid, oil, all kinds of stuff. But this kind of concerns me. I see no helmet on him. I see no helmet on him. A baseball cap. That's not going to protect your head. Looks like a hard hat on that guy, but nothing on that guy. Plus, these vehicles, this vehicle right here is way too close to this scene. This is a flammable fuel, a flammable, this thing could blow any time. If any little leak, any little spark. And remember, there's batteries in here. There's all kinds of stuff. These people are way too close. These apparatuses are way too close. Yes, it's a bad accident scene, but y'all need to back off. Way too close for this kind of incident. So these are things that I'm going to see when I overview this scene. I'm going to go, whoa. If I'm in command here, we're going to move people away. You're too close. Okay? It's just, I don't see any safety cribbing. I don't see anything. So again, this is a very dangerous scene. All right, step 2, stabilization of seeing any hazards, infectious diseases. Many patients involved in motor vehicle crashes have soft tissue injuries, so they're bleeding. Make sure you have your gloves on. Eye protection. Yes, gotta have eye protection. Eye face protection. That's your stuff splatters on you. Now you've been exposed. So just at minimum, eye protection and gloves. Period. All right, traffic hazards. You need to park your vehicle so it blocks the traffic. Park so you can use your vehicle's warning lights to the best advantage. Safety vest. That was another thing we didn't see in that picture. People weren't wearing safety vests. Ignite fusees or warning flares as soon as possible. Do not use fusees or flares unless they're way away from the scene because of fuel, people. It's flammable. Survey the scene for any other hazards that you may see. Bystanders, keep them away. Get them out of there. And don't forget, media is going to show up, especially if it's a big event. You need to put somebody in control of that. And the best people that can control those scenes is going to be your law enforcement. Put them on it and say, we need to keep these people back. This is a hazardous situation. Spilled fuel, expect to find it. Fuel spill, if the motor vehicle's been hit near the rear or on its side, or if it's upside down. All right, so if the fuel is spilled, present, call the fire department. If the patient's in the motor vehicle where the fuel spill and the fire department has not arrived, consider covering it with a dirt and get them out of there if it's feasible. I like this picture. We've got folks that are wearing helmets. She's not very happy about that. Neither is this person sticking his head inside the car. Neither one of these two have a safety vest on that I can see. He's got a helmet right there, so that's a good thing. But here's another thing. This is all what we call cribbing. Okay, it's to stabilize the vehicle. That's very good. This is a heavy vehicle. This is a Cadillac, man. These things are built like tanks. Look at the damage. There's a significant amount of frontal damage. And what looks to be, if you looked over here on this driver's side, looks like they may have been hit by the driver's side because this is all crumpled in this area here. And windshield's also out as well. So not good. All right, so batteries. Turn off the vehicle's ignition. Do not attempt to disconnect the battery unless you've been trained to do so. Hybrid vehicles and electric vehicles, they have large quantities of batteries and they will kill you dead. If you don't know what you're doing, stay away from it, period. Let the folks handle it that have had training, so please stay away from it. Down electrical wires, they may be caused by high winds, ice buildup, or a vehicle hitting a utility pole. Locate those wires but avoid contact with them. Stay away from them. If the vehicle has a down wire across it and passengers are trapped inside, tell them to stay inside the car. Call the utility company so it can get disconnected. The utility company, fire department for assistance, but have them stay inside the vehicle. Unstable, assume that every vehicle involved in a crash is unstable unless you have stabilized it. Vehicle on its wheels, ensure stability by chalking the front of each wheel. You can gain access to the inside of the vehicle, place transmission in park, and set the brake. Deflate the tires by cutting or pulling out the stems. That will definitely make a vehicle that's on all of its wheels stable. There you go. There's an example. Just take your knife and cut the stems, and this is what we mean by chalking the wheels. All right, so this looks like a bad crash here. This vehicle is on its side. It's got tons of damage. Okay, I like the fact that these folks are wearing reflective clothing. Helmet on, this guy does. I'm not sure about this guy, he doesn't look like it. But anyhow, this is also, looks like in Europe somewhere, because this is definitely a different type of fire vehicle. And that's a European fire clothes, but this is significant. This is a rollover. Okay, so vehicle at its side or it's upside down, don't climb on the vehicle. Break the rear window and glass and enter through the back rather than anywhere else of the vehicle. Primary hazard of the upside down vehicle is the spilled gas. Vehicle fires, impact fires occur when the gas tank ruptures, during the crash. Post-impact fires are often caused by electrical shorts. So the battery, that kind of stuff, it can be prevented by simply doing one thing. Turn the ignition off because you have just grounded the vehicle, so we shouldn't have anything. And if you do, it's because there's a loose wire somewhere. Okay, emergency actions for motor vehicle fires. Use a dry chemical fire extinguisher. Okay, use the extinguisher to keep the flames out of the passenger compartment. You have here, identify what it is, make sure it's the right one. Okay, hold it in the proper position, pull the pin, hold the nozzle, and then spray using a sweeping back and forth kind of motion. back and forth. Don't just spray it right directly on it. You may cause it to be worse. It may splatter. So you want to sweep across of it until you extinguish the flames. All right, emergency actions. Do not overly worry about discharging extinguishers onto the passengers. No big deal. It's not going to hurt them. Have someone else gather fire extinguishers from other vehicles if you need more, Remove patients as quickly as possible. Move everyone at least 50 feet away from any vehicle that's on fire, and stay away from the front and rear ends of any burning vehicle, because that's where the explosive stuff is. You want to be off to the side if anything else while you're trying to get the fire out. All right, so access, step 3. Access to the doors. Try all doors first. Just open the door. If you have to, reach in there and unlock it, okay? Ensure the locking mechanism is released, and try the outside and inside handles at the same time. Be amazed how many people start cutting into a car and they just simply can go to the other side and open the door. So try the doors first. All right, so through windows, do not try to break and enter through the windshield because it's made of a plastic laminated glass. It's a safety glass. As you can see here, there's a strong laminate that's on the outside. Use the side and rear windows. They're tempered glass and they'll break out very quickly. Center punch, that's what this is. You should have one in your first responder kit. Carry that spring-loaded center punch. If you must break the window, try to break the one that's farthest from the patient so the glass won't get in their eyes. We do have a skill drill for that, and we will practice that. Access to the windows continue. When you gain access to a crashed vehicle, be alert for their undeployed airbags. These are dangerous. If you do not see an airbag deployed in front of somebody, there's drivers sitting there, the wheel's sitting in front of them, don't get in the middle. Because if that thing goes off, it could potentially harm or even kill you. So, cannot gain access to the vehicles. Just stabilize the vehicle and protect the scene until proper equipment arrives. Step 4, initial emergency care. ABCs, controlling bleeding, treating the patient for shock, cervical spinal mobilization or stabilization, give emotional support, and maintain body temperature with a blanket. Leave the patient in the vehicle unless the vehicle is on fire or the patients are otherwise in an immediate danger. So we're going to practice skill drill 20-2. It shows how to perform an initial airway management when the patient is in the vehicle. We will do that in lab. All right, step 5, patient disentanglement. Usually requires tools and specialized equipment. Some serious extrication situations, detanglement can take up to 30 minutes. I mean, you can see here that there's a lot of stuff going on here. All right, notice that this guy has no protective gear on whatsoever. Should not even be in there. He doesn't even have glasses on, let alone a helmet or turnout gear or anything. He's just wearing a shirt, so not good. Don't be one of these people. Golden hour, the less time you spend at the scene with a seriously injured patient, the better. The patient's chance of survival increases if rescuers can get the patient out to definitive medical care as soon as possible. That's what that golden hour is. It starts from the time of injury until the person gets definitive care. And usually that definitive care is surgery, okay? Because we can't fix what's broke on the inside. A surgeon can go in there and fix it, but we can't. All right, step 6, preparation for patient removal. As disentanglement proceeds, dressings, bandages, and splints are applied, and the patient's head and spine are stabilized. The access route used to care for a patient may not be adequate as an extrication route. So you got to think about that. Can we get the patient out the way we came in? So we need to make sure it's large enough to permit a safe extrication of that patient. All right, step 7, actual removal itself. Once the patient is packaged, he or she is removed from the vehicle and placed onto a stretcher. Although EMRs are directly involved in only the first 4 steps, you should be aware of the entire operation. All right, so review of the extrication process. Call for additional resources when you get there and extrication help. Specify the number and types of vehicles involved. Do not stand idly while waiting for help, so identify and contain any hazards. Park your vehicle appropriately. Clear a working area around the crash. Use your head. Think about things. Don't go rushing into something and get yourself hurt. So make sure that you're thinking all the time and being safe about everything you do. Try opening the doors first rather than breaking windows. Once you gain access to these patients, remain and monitor their conditions, and above all, remain calm. All right, so water and ice rescue. And again, I want to reemphasize that this is a specialty type of rescue operation and that you have to go through training for this. But basically, reach is the first thing we're going to talk about. Use any readily available object to reach to them. If the person is close to shore, a branch, a pole, or paddle may be long enough. Throw. At a swimming pool, dock, or supervised beach, a flotation device should be available, so make sure to throw that to them. Throw a life buoy if one is available. Some public safety departments carry a rescue throw bag that contains a rope as well. If these devices are not available, improvise. Row. Row out to the drowning person if a small boat or canoe is available, and wear an approved personal flotation device. Finally, go. This is a last resort. You may have to go into the water to save the person, but I want to reemphasize only if you're properly trained. So enter the water only if you're a capable swimmer, trained in life-saving techniques. Remove the unencumbered clothing before entering the water and take a flotation device with you. Reach, throw, row, or go. Okay, this diagram illustrates exactly what the four components are of water and ice rescue. All right, so initial treatment of persons that are in the water. If you're involved in a water rescue, your primary concern must be to open the airway, establish breathing and circulation, stabilize spinal cord injuries. We're going to talk about all this in your lab. We're going to perform a lot about doing face down removals in the water on skill drill 20-3 in your lab component. Okay, so other initial treatments, you can use the jaw thrust maneuver, look, listen, and feel for signs of breathing, and if the patient's not breathing, start rescue breathing in the water. Give them 5 big rescue breaths, big old blows. Don't hyperextend the neck, that's very important. And then making sure that we get good chest rise when we're blowing into their mouth. If the patient has experienced cardiac arrest, we want to quickly stabilize the patient's head and neck, remove the patient from the water, place the patient on a hard surface, and begin cardiopulmonary resuscitation or CPR. Treat a patient who is unconscious in the water just as if a spinal cord injury is present, and do the best you can to immobilize the patient. Assume the presence of that spinal cord injury if a conscious patient's in the water, if they report any numbness or any tingling in the arms or legs, or if they're unable to move their extremities, or if they're reporting any neck pain. So this is a conscious patient. All right, so strap the patient to the backboard, stabilize the head and neck, and remove the patient from the water. So this would be commonly your patient who's conscious that you're going to backboard them in the water, especially if they're complaining of neck pain, any tingling in their arms or their feet, or any back pain, that kind of thing. All right, so diving injuries. Most recreational divers use self-contained underwater breathing apparatus, or scuba. Scuba gear consists of an air tank, a regulator, a mouthpiece, and a face mask. Diving accidents can cause trauma, near drowning, or specialized types of injuries. Specialized types of injuries with diving include air embolism and also decompression sickness, or otherwise what is known as bends. Both are caused by air bubbles that are released into the body as a result of pressure changes while diving. Treatment, ABCs, give them oxygen if you haven't and you're trained to use it. Some physicians recommend placing the patient on the left side with the head slightly lowered. Patients may need to be transported to a hospital or a hyperbaric chamber within the hospital or even outside the hospital. Make sure you know your local protocol with diving injuries. Ice rescue. Well, I'm currently doing this in Florida. I live in Florida. We don't have ice like this, but we can get hypothermia here. Anybody can get hypothermia in any water or any body of water that's less than 98.6 degrees because that's our normal temperature. But no ice, when we're talking about ice, is truly safe. Visually mark the location where the person was last seen. Basic rules of ice rescue are the same as water. Reach, throw, row, or go. Reach for the victim using anything that will extend your natural stretch. Throw a flotation device, a rope, something that they can grab a hold of so that they can get pulled in. Row or propel a small boat to the victim or use a toboggan to get across the ice. If you must go, secure yourself to the shore with a rope around your waist, allowing your stomach, and proceed across the ice, as you can see here in this situation. Man, that just looks cold. Woof. Motor vehicle on the ice presents a very risky situation because it can go through the ice anytime. Instruct the occupants to avoid any unnecessary movement. If the vehicle has not gone through the ice, instruct the occupants to open the doors. If the doors cannot be opened, instruct the occupants to roll down the windows. Both the persons on the ice or in the water and the rescuers are at risk for hypothermia, folks. Hypothermia can kill you. Keep all rescuers as warm as possible. Rescue persons should be stripped of any wet clothing, dried, warmed, okay? If the patient has no pulse, start CPR and continue until the patient has been transported to a hospital and rewarmed. Confined space rescuer. Confined spaces are structures designed to keep something in or out. Below ground confined spaces can include manholes, below ground utility vaults or storage tanks, old mines, cisterns, and wells. These are examples. Ground level confined spaces, industrial tanks, and farm storage silos. Again, I want to reinforce the fact that this is a specialty kind of rescue group, especially when it comes to elevated confined spaces such as water towers and tanks. It takes a special crew to get up there and work around this stuff because you've got a lot of equipment to maintain your safety. Rescue situations involving any of these confined spaces have two deadly hazards. The confined space may not have good oxygen, okay? It may not have enough to support life, and it may also have a poisonous gas in there. There's also a danger, always a danger of collapse of that structure. Call for help. Don't go in, just period. Call for additional assistance. Don't enter the space until help arrives, and then you can take part of that team based on whatever your level of training is. Here's some examples. Here's a confined space rescuer. Notice he's in a culvert pipe. Here's some examples of high angle stuff, water towers, and then concrete towers like this, or grain silos, that kind of stuff. These are high rescue, could be confined space. They could be working inside of here. They could be working inside of here as well. Farm accidents, yeah, many challenges. Reporting of an emergency may be delayed if the farmer works alone. If he's out in the field, it may take a while for him to get to a phone, or his phone may not work. So there could also be a lengthy response by the time people get there. It may be also hard to pinpoint the exact location of the emergency. If they're out in, say 10,000 acres and they're calling and say, I'm out here on the farm, unless they can give, exact GPS locations, or if they're able to leave their phone on, it's going to be hard to find them, to find exactly where they are. Poor roads, non-existent roads, muddy soil may require to leave your vehicle behind. Farm hazards, animals like big bulls, that's probably one of the worst. Pigs too will get you. You just nope. Pigs can consume everything, so you need to stay away from those. Hazardous chemicals, including pesticides, herbicides, and fertilizers. Electronically powered machinery and tall barns. This is a silo here. Usually holds grain and silage and that kind of stuff. These can be very dangerous. They only have two entrances, one that's down at the bottom, and if this is full, half full, or whatever with grain, you can't access through there. You have to access through here, okay? So dangerous. And this is some kind of tank that, looks like it's collapsed. This is not a good type of situation to be in there because it's falling apart. Maybe a short silo. Kind of looks like a short silo. All right. Below grade manure storage pits, accidents with farm machinery. I mean, look at this equipment. There's tons of equipment. We have planters, we have sowers, we have cutters, we have all kinds of stuff. Rollovers of farm tractors is predominant, and entrapment underneath the machinery is part of it. And severed, extremities such as your arms, your legs, those kind of things can happen very, very easily. All right, so your role in farm rescues, stabilizing the scene and provide initial patient care. Follow the 7 steps of extrication. This comes from table 20-1. Conduct your scene size up, stabilize the scene, gain access, provide emergency care, help disentangle patients, help prepare the patients for removal, and help remove the patients. All right, so bus rescue, another great program. I really enjoyed going to my bus extrication and rescue courses. It's really neat. It learns a lot. Buses are built pretty solid, and taking them apart takes a lot. But crashes involving buses are considered multiple casualty events. Your role in bus rescue is perform your scene size up, call for adequate police, fire, and EMS resources, and establish an incident command system if multiple casualties are present. Set up a one-way traffic pattern for responding vehicles. Okay, with a large number of patients, you need to triage them using your triage system. All right, so in summary of this chapter, you need to be able to perform the first 4 steps of extrication and assist other rescuers with the remaining steps. Ice rescue, water, underwater diving accidents, confined space. Farm rescue and bus crashes are situations that require extensive skills and special training. And it's a lot of fun. If you get a chance to go to these classes, do so. This is good stuff, really good training. And it could lead you being on some kind of specialized team that could be working with the fire department to do these kind of skills. Water ice rescue situations, simple steps, without endangering self, make sure reaching out to the person with an object, throwing a flotation device to the person, or rowing to the person in a boat. Simple stuff. In confined space rescuer, your primary goals are to call for additional assistance. Don't go in there. Don't become a victim. Okay, stay out of that. Then, of course, farm emergencies and closing and bus crashes are complex rescue situations. They take a lot of team effort, so you're going to need to make sure to get people there to help you. All right, you know what to do. Assessment time. Go ahead and do your assessment for this chapter on the assessment block. Make sure you get a 70% higher for your cumulative score. If you have questions, let us know, student@emets.net, and we will see you very shortly for the last lecture. Have a good one. We'll see you then.